Okay.
Hello, we are Anjali, Eva, and Diya, and this is Host of Mind Matters. Today we are interviewing Dr. Ryans, a psychiatrist. We will be asking questions regarding anxiety and depression. So, to start, I wanted to ask from your clinical experience, how common are anxiety and depression among teens and youth adults today?
Yeah, so they're very common. It's actually about 1 in 5 of teens nowadays experience some sign of anxiety or depression now.
Okay, and are you seeing these conditions appear at younger ages than in the past? And if so, why?
Yeah, there has been a trend towards getting younger and younger for the onset of anxiety and depression. And there's different drivers which we think might be contributing: exposure to chronic stress, social media, sleep disruption, academic and extracurricular pressure from that, and oftentimes poor sleep and poor time for recovery.
Mhm.
So APA and other groups emphasize that it's a very sensitive developmental period and stressors can have outsized effects for the rest of life.
Okay. And how do anxiety and depression typically show up in differently in teens compared to adults?
Right. Good question. So with teens, it can be more behavioral symptoms like irritability, emotional shutdown, or getting in fights. It's less likely that they'll say, I feel depressed or I feel anxious, like in adults. And also there can be avoidance, like refusing going to school, or like rigid perfectionism, or excessive reassurance seeking, or anger, changes in friend groups, or complaining of lots of new physical problems.
Okay.
Next, we're going to be moving on to our other topic, which is early warning signs and red flags. Our first question in that is, what are the most common early warning signs of anxiety in teens that adults often overlook?
Right. So avoiding previously enjoyed things like going to school or doing presentations or sports events, social events, or overly checking grades. And even in adults, people stop doing activities suddenly. That's a warning sign. Also, like you mentioned, over controlling, perfectionism, and excessive reassurance seeking, and physical symptoms.
What behaviors might indicate depression rather than normal teenage moodiness?
Great question. So, um, major depressive disorder in the Diagnostic Standard Manual, a revised version 5, which is the current one, you have to have two weeks of 5 or more of 9 symptoms, and that's change in sleep, appetite, energy, concentration, motivation, um, or enjoyment, and also suicidal ideation and I would say changes in concentration. It's hard to remember them all. But normal moodiness can be shorter lived, and you're not going to meet all these 5 out of 9 criteria, causing impairment in functional, occupational, or emotional domain.
Are there any emotional or behavioral changes that could prompt immediate concern?
Yeah, for immediate concern, time, even if people are joking a lot about wanting to die, or talking about self-harm, or giving away prized items, or if they suddenly withdraw or been not sleeping for days, if they're using any substances and doing risky behavior that way, or a dramatic personality shift can trigger a red flag.
Hmm. How can anxiety and depression affect academic performance, friendships, or family relationships?
Good question. So anxiety can cause avoidance and perfectionist tendencies that can lead to missed work, late work, or panicking before a test. Anxiety can even, have panic attacks, which is a full-blown short episode, and hard to start tasks. And depression can reduce energy, motivation, and concentration. Often, depression leads to worse grades or being more socially isolated, being irritable, more conflict at home.
Are there any physical symptoms like headache, stomachs, or fatigue sometimes signs of mental health struggles?
Yeah, so some of the common ones with anxiety and depression that are reported in the body with teens will be stomach aches, headaches, fatigue, nausea, appetite change, muscle tension, or dizziness. Although it can be hard because these can also just be physical sign of another condition.
Okay, thank you. Now we're going to be moving on to risk factors and triggers. So, what factors put teens and youth at higher risk for anxiety or depression?
Great question. So there are many different risk factors. A very strong one is having a family history of somebody, especially a first degree relative, like mother, father, um, a sister, brother, who had anxiety or depression. Any trauma or chronic stressors, bullying victim, or person who's committing the bullying also is a risk. If they face discrimination, any sleep deprivation, substance use, learning challenges, any major loss, like a loved one, limited social support. So the key thing is like the number of the more you have, the worse it is, and the more you have and the less support, um, that raises the risk.
Okay, thank you. So, how do social media and academic pressure and peer comparison impact mental health?
Right. So yeah, we haven't had this for that long in human history. We've only had it for a short time. It can really lead to amplifying comparing ourselves to other individuals, which in our society we didn't used to do that all the time. We can be very sensitive to rejection and put a lot of pressure on body image because we're always seeing people that look better. And then sleep disruption from using those social media late into the night and have the blue light exposure. So also academic pressure can turn stress into chronic stress if there's always this feeling of really high expectation and the risk of failure feels catastrophic.
Okay, so what role do family dynamics or life transitions play?
Yeah, so transitions can be destabilizing, like divorce, moves, illness, new school, grief, family conflict, or financial stress. So yeah, we ask about that anytime we do a psychiatric interview. We ask about those sort of things. And even a positive transition could raise anxiety because any teen, a child or a teen, what you need is predictability and stability. So even something that seems like is better could also have a negative effect. So the most protective family factor is just a reliable family.
Okay. The last one for this category is, are certain personality traits more vulnerable to anxiety or depression?
Yes. So some traits can increase vulnerability, especially when stress is high. If somebody has a high sensitivity in general, they have perfectionist traits, they're a people pleaser, or strong fear of disappointing others, or have some harsh self-criticism. So those aren't necessarily something bad, but it could definitely um, they definitely would need to develop skills and support so that doesn't turn into vulnerabilities.
Thank you for that. And now moving on to our next topic, how teens may hide their struggles. For the first question, why do many teens and young adults hide or minimize their symptoms?
So that can be due to many different things, but they can fear being judged, feel being like a burden, or that you'll lose independence, or adults will overreact. So, and sometimes teens and young adults don't have the words for what they feel, or they try to mask it with humor, anger, or just saying everything's fine.
And what are some subtle ways the youth may express distress without directly seeking for help?
All right. So, some of these signal behaviors could be more alone time, less joy, more irritable, sudden drop in grades. They start quitting activities. They're less engaged at frequent nurse visits, change in sleep. They could be using substances. or again, with that overly perfectionistic, overly avoiding things for the anxiety.
And last question for this, how does stigma around mental health affect whether teens seek support?
Yeah, great question. Stigma in mental health has been around for a long time. Thankfully, it's getting better nowadays, but it often delays care because if a teen thinks anxiety or depression equals weakness or I'm crazy, then they're going to wait as long as they can to come in, and sometimes things can get a lot worse. So normalizing mental health as just regular healthcare, just like any other medical condition, can reduce shame and improve early help seeking.
Now we're going to move on to our next topic, which is how parents, teachers, and caregivers can help. Our first question is, what's the best way for an adult to start a conversation if they're worried about a teen?
So a good example of this would show concern for what's going on while remaining calm and specific. You could say something like, I've noticed you seem more stressed and pulled back lately, and I care about you. Can you tell me about what's been hardest for you? So just listen and be curious about what's going on with a child, have an open attitude.
What language should adults avoid when talking about anxiety or depression?
Right. So the worst thing to do would be minimizing or moralizing. And what I mean by that is minimizing, like, just relax, you have nothing to be worried about, stop being dramatic, or moralizing, like making you feel bad for having this, like other people have it worse, or you're trying to just get attention. So instead, it would be better to validate the emotions and try to ask curious questions to learn more about what's going on.
How can parents balance being supportive without feeling intrusive?
Yeah, so you want to use support while also giving some autonomy. So check in consistently, but offer choices and collaboration on the plan. So like, do you want to talk about this now or after dinner? And you can agree on different boundaries while still remaining clear that safety is non-negotiable.
For our last question on this topic, it's what role do schools and teachers play in early identification and support?
Yeah, thank you. Very good question. So schools are often the first place where changes show up first. It's not just anxiety and depression, ADHD. Um, ADHD is reported by the teachers and the parents complete surveys. So schools, usually people in the school can notice attendance or grade differences or social withdrawal and behavioral shifts. So it's important to be in contact with teachers and counselors and what they're saying. So they'll also be people who can provide accommodations. Like in ADHD, there's 504 IEP plan. If somebody has anxiety or depression, there may be also accommodations that can be done, and they can connect the family to support and normalize the help seeking.
Thank you. Now we're going to be moving on to the category of when and how to seek professional help. So the first question for that is, when should anxiety or sadness be evaluated by a mental health professional?
Good question. So when symptoms persist for weeks, like we said, anxiety and depression in particular, you need to have for a couple of weeks. Normal moodiness can be less than that, just a couple days less. Symptoms happen for a couple of weeks, or they're getting worse and worse. You're having disruption in your school, your sleep, relationships, your daily functioning. And sooner than that, you don't even have to wait at all. If somebody has self-harm or suicidal thinking or severe panic or using drugs or major behavior change, then that's a immediate concern.
Okay, so what types of professionals can help and how do families know where to start?
Great question. So a lot of times it's not firstly going to a psychiatrist. So it's usually you see like your primary care doctor, pediatrician, or school counselor for the initial screening and referrals. And they may send you to a licensed therapist to do therapy, talking about the problems, which can be very effective, or they can refer you to a psychiatrist, which we can do talking about things too, but it's more medication management.
Okay, so what should families expect from an initial psychiatric or a therapy evaluation?
Right. So it's a branch of medicine. So you expect the same thing as other medical evaluation. You're going to give the symptoms, the onset, the stressors, school functioning, sleep, substance use. We'll get your medical history, family history, and the the end should the visit end should have a clear plan and next steps, and then the follow-up appointment.
Okay, thank you for that. For the last question of this category would be, how do therapy and medication fit into treatment, especially for teens?
Very good. So therapy is first line often for mild to moderate symptoms. Um, and for moderate to severe anxiety or depression, oftentimes we use medications like SSRIs. Um, and it's even better when you combine SSRIs or other similar medications with therapy. It boosts it, boosts the effect.
Thank you for that. And moving on to the next category, supporting recovery and building resilience. Um, what does recovery look like for teens with anxiety or depression?
Right. So recovery usually means some improved functioning, not never feeling anxious or sad again. Unfortunately, these are like very chronic conditions that you have many recurrences, and people can have this happen again and again over their life as different stressors happen. They have a susceptibility to these issues. So it's important to have healthy, manage expectations, realistic expectations. But with building skills and rebuilding routines and re-engaging with peers and activities and developing confidence, now the idea is that these emotions are manageable and you can go back to life and have improved function again.
Okay. How can families support healing beyond therapy sessions?
Good question. So the home should be like a recovery environment, very warm and predictable, not chaotic. It's best to celebrate the effort that the teen is making in the therapy, even if it seems like progress isn't being made or stuck, and always just keeping the communication line open.
And next, what healthy coping skills are especially effective for the youth?
Right. So skills that work good that you could even do at school are paced breathing techniques like box breathing, which can help with anxiety and can be done even in the classroom. And there's behavioral activation techniques for depression, which if you're not motivated to do things, you do small steps which get the ball rolling, and you're able to do all the things you need to do. And there's gradual exposure for avoidance for anxiety, because you have to originally face you have to eventually face the feared thing, or it's just going to get worse. Also, journaling for mood tracking and structured social support system.
And finally, how important are sleep, nutrition, routine, and physical activity in mental health?
Yeah, it's essential because your body is a, a chemical experiment, just like all the other organs in your brain. Your brain is made of tissues, just like all the other parts of your body. So they require sleep and healthy nutrition that has all the nutrients that cells use to function, and staying hydrated. And sleep has been proven to improve. Good sleep improves mood, anxiety, concentration, impulse control, and exercise improves response to stress and mood regulation, likely through controlling cortisol. Cortisol is a stress hormone. When you are exercising, your response to stress, response to cortisol is better. And mood regulation because you're getting more blood flow, different parts of your body getting more blood flow in your brain. Yeah.
Okay, thank you. Our next topic is crisis safety, situations, and safety. Our first question is, what warning signs suggest a teen may be at risk for self-harm or suicidal thoughts?
Very, very important. So warning signs include talking about death or feeling like a burden, self-harming behaviors like cutting, severe withdrawal, major mood shifts, and increasing substance use, giving away treasured possessions, or writing a goodbye messages, or taking unusual risks. Those are the main ones, but sometimes people could not have this.
What should a parent or caregiver do if they fear a teen is in immediate danger?
Yeah, always treat it like an emergency. Stay with the teen. Make sure that they don't have any access to lethal means, like firearms in particular, and or any pills which they could overdose on. Anything like that. Contact help. You can call 988 in the U.S. That's the suicide and crisis hotline, and or in general, you could call 911.
The last question in this is, how can families create a safety plan that feels supportive rather than scary?
Good question. So, a good idea to do that would be frame it as a team homework assignment, not a punishment. So, a supportive safety plan would include the teen's warning signs, the coping steps that help, people they can contact, professional and crisis contacts, and a plan to reduce access to lethal means. Should be periodically updated together with the parent or guardian, and this for free. You can go on the Google Play Store, and it's a VA safety app. You can access one for free.
Okay, thank you. So our last category today is about hope, prevention, and final advice. So what gives you the most hope when working with teens facing anxiety and depression?
Yeah, the best positive is that teens are highly changeable. They're way more resilient than adults, and the brains are building new pathways. Your brain isn't really fully developed until you're around age 25. So there's a lot more potential for the right recovery, and it can happen faster than in adults.
Okay, so what preventive steps can families take to support mental well-being early?
Good question. So again, with taking care of your general health, prioritize sleep, consistent routine, limit nighttime screen use, and have healthy family meals and regular check-ins with parents and a supportive involvement with school life and normalizing emotions that you can talk about with your friends or family when you feel something, and teaching the coping skills and making mental health just like receiving any other type of health care. It's not a big deal.
Okay, if there's one message you want teens to hear about anxiety and depression, what would it be?
So it's both of those are very treatable, and asking for help is a sign of strength and not weakness. And the sooner you can get help, the sooner you can get better.
Okay, and then the last question for today is, what's one piece of advice you wish every parent or caregiver knew?
So yeah, a parent's job is not to like have the perfect thing to say or always know exactly what's going on with their child. It's to be emotionally present and taking concerns seriously, and just be there as somebody reliable who's a steady support.
Okay, thank you for your time, and thank you for the great advice and information today. We hope people can get impacted by your strong message and your feedback. And yeah, thank you so much for spending your day with us today.
Yeah, of course.